Hi, everybody. Welcome to week 2 on a little bit of a delayed start of the ARC Michigan's Disability Policy webinar. Thank you for being patient as we had a little moment of technical difficulties getting our presenter into the meeting. So before we get started, if you're not familiar with GoToWebinar, you're going to want to locate the orange arrow in the upper right-hand corner of your screen. This toggles your GoToWebinar control panel. If you're joining via the app on your phone, the control panel is at a pull-down menu at the top or bottom of your screen. If you have any issues with your audio, you're going to want to go into the control panel, do the sound check for your mic and speakers. We're having our presenter join us in a little bit of an unconventional way today. So if we're having trouble hearing, let me know and we'll stop the presentation. Participants are muted, but questions or comments can be typed into the GoToWebinar question window within the control panel. There is a link to the handout for today's session that is in the GoToWebinar control panel, and you can also find it on the ARC Michigan website. If you lose your GoToWebinar screen, you're going to want to click on the blue flower icon in your taskbar, unless you're on an Apple device, and then you click on the orange flower icon. Now I'll hand things over to Sherry Boyd, CEO and Executive Director of the ARC Michigan. Good morning, Sherry.
Good morning, Emily. Thank you. I apologize for the delay. We're going to try to make this work this morning. Christin's actually on my phone and we're running it through to my speakers on my computer. So we'll see how it goes. If you guys cannot hear, please put that in the chat and we'll stop the session and record it privately and then send it out. And then if you have questions, you can email them in and we'll get answers for you. So I'm sorry that things aren't working as they normally do this morning. Without further ado, I want to welcome Christin Nohner. She's our lobbyist at McCall Hamilton, and they recently changed their name from RWC Advocacy to McCall Hamilton. I want to thank Christin. It's a real pleasure to work with their organization. They've been working with the ARC for a long, long time. You're not going to be able to see Christin's beautiful face this morning, but she will be on the phone. And without much more delay, I'm going to turn it over to her. Thank you.
Thanks, Sherry. Hopefully everyone can hear me okay. I have my phone up close to my hopefully that this comes through. And I apologize, not to be a broken record, but I do apologize for the technical difficulties. We've tried multiple computers in my office and for some reason don't have a plug-in or something that is beyond my area of expertise. So we will move forward here. I appreciate the introduction from Sherry. She did mention that our firm recently rebranded from RWC Advocacy to McCall Hamilton. It might be of somewhat minimal interest to this group. I do want to roll into, the meat and potatoes of what we're talking about today, what's happening in Lansing and how to be an effective advocate. But before we do, I just wanted to advance the slide to kind of our rebranding, how we came to be called McCall Hamilton, and then go from there. So on May 2nd, firm's name changed to McCall Hamilton, and if, for those of you who don't know, it's named after Eva McCall Hamilton, who was the first woman elected to the Michigan Legislature in 1920. She actually was elected, right after the ratifying of the 19th Amendment. She's someone who isn't as well known around Lansing, surprisingly, as you would think, and so as we kind of dug into her history and bio, we learned a lot about her and a lot of the policy areas that she worked in aligned with a lot of our firm's mission and values and the wonderful organizations we work with, like the ARC. She was a big advocate for women, children, persons with disabilities. She was kind of spearheaded to bringing in the first farmers markets in the Grand Rapids area and, kind of expanding that statewide. So lots of really cool areas that she worked in. Also being the first female legislator, we wanted to celebrate that. As our firm is a women-owned business. So with that, I will roll into the current Michigan government landscape. I always like to kind of start here to provide some context as far as what we work in, the political dynamics that the ARC has to navigate, the parties that are in power, the various players who make all the decisions, and who we talk to and attempt to influence through our advocacy. So we'll start with the executive branch slide. We obviously, within the executive branch, we have the executive office of the governor, and then the state departments and agencies. And I wanted to just call out a few key agencies that we work with on behalf of the ARC Michigan. Obviously, the Michigan Department of Health and Human Services, and then the Michigan Department of Education are the two that we probably interface with the most. MDHHS probably most of all. And then within MDHHS, the newly named Behavioral and Physical Health and Aging Services Administration. I'm going to go into the reorganization very briefly because I sense that you've had previous speakers talk more about that, who are much closer to that and more familiar. But I did want to make sure I mentioned that because it is helpful context as far as our advocacy efforts go. Rolling into the MDHHS leadership team, again, it's helpful to know the players at the highest levels and those making the decisions. So always like to lay out this slide, and it changes every year because we do have turnover. This year, we've just recently had our Medicaid director move on, so we do have a vacancy there, which Vera Hanley, the chief deputy for health, is temporarily filling. But we still have Elizabeth Hertel as the director, and that's no change from last year. David Kniezek is the chief deputy for administration. He kind of oversees, part of what he oversees is the Bureau of Children's Health Policy and Supports, which is a newly created entity spearheaded by Lindsay McLaughlin. And then we have Dr. Bagdasarian, who's the chief medical executive, Dr. Mellows, who leads the state hospital administration, Jeff Weefridge, and then I wanted to also mention Ramiro Galvin, who is the legislative liaison for the department. So he's the kind of conduit between the department and the legislature. The department is trying to get things done through the legislative process. He's the point person in trying to move things within the two legislative chambers. Really quick and kind of high level overview of the organization of MDHHS and this kind of new BPHASA entity. So Farah Hanley is the chief deputy for health, as I mentioned. Under her, there's sort of two branches, the state hospital administration and then BPHASA. So Dr. Mellows on one side and then whoever will fill that role eventually. So that's kind of a high level view of how that's organized. So rolling into the slide on the new BPHASA, it was absorbed the former Health and Aging Services Administration, which was in existence for not too long, actually. And then it oversees, among other things, community-based services for adults with intellectual and developmental disabilities. SUD and serious mental illness is also services are also under BPHASA. It's oversees Medicaid and aging services. Many of the functions of what was formerly the Behavioral Health and Developmental Disabilities Administration was absorbed by BPHASA, dispersed throughout various entities. So it sounds unwieldy and complex. It is. We're still trying to get our arms around it. I think folks within the department are still navigating how it functions on a daily basis, whatever one's role is, and really the impetus for it was to help improve children's services and coordination of children's services. So there's, as I mentioned, the new Bureau of Children's Health Policy and Supports that was created, and then BBHASA was sort of a product of that movement to provide more coordination of children's services. I mentioned, what happened to the Behavioral Health and Developmental Disabilities Administration, and so, we can kind of move on to the next slide here. I'm going to roll right into from the makeup of the regulatory landscape to the legislative landscape. I haven't heard that hard to hear, so I'm going to take that as a good sign and keep moving forward. So I've shown this slide in the past. It's a map of the 5 types of state legislatures as delineated by the National Conference of State Legislatures. And I like this slide, and I like talking about this because it reminds folks who are doing this work in Michigan that we have a very active legislature, much more so than many other states. So I would say we're more similar to Congress, and we're one of the dark green states, considered full-time, well-paid, with a large staff. And you might think, well, they only have like 2 people in their office, but relative to their counterparts across the country, that is actually considered a large staff at the state level. The other distinguishing feature of these green states is because they are full-time, generally the legislators do not maintain occupations outside of legislating. There's certainly exceptions to that. If you're a chiropractor, I have ideas of certain people, or a physician, or a psychologist. There's certain people who will maintain their side hustle with their business. If they own a restaurant, they certainly can keep that business on the side. That's not prohibited. But generally, you cannot have a full-time job while you're legislating. And so that's different from other states where, for example, gold states, you're forced to have other sources of income in order to make a living. And you notice that the gold states are typically, have smaller populations or are more rural. The NCSL calls these kind of traditional or citizen legislatures. So it's a lot more informal, and again, every legislator that comes out of those states has to maintain a full-time position outside of legislating. So again, Michigan, what I like, the way I like to think about it, it's very similar to Congress. We probably have a few more breaks than folks in DC, so it really is go, go, go. Rolling on to the next slide with the outline of the legislative branch, it's important to remind everyone that we do have term limits, and in Michigan, they're among the strictest in the nation. In the state house, House representatives serve 3 terms of 2 years each for a total of 6 years, and then in the state Senate, they serve 2 terms of 4 years each. And you can serve a total of 14 years. So we see folks serving their time in the House and then moving over to the Senate. We even see senators fulfill their time in the Senate and move over to the House. This year has been, and I'm going to get into redistricting in a moment, this year has been very atypical because of redistricting, and we have folks in the Senate who are moving over to the House due to the way the districts were drawn in their primary races, and then potentially coming back to the Senate. So there's a lot of shifting that can go on, but as long as you're within that 14-year time frame, you can make those moves, and you still have time left in the House. For example, if you are a member of the House, you got elected to the Senate in your going into your second term in the House, you could go back to the House and fulfill those 2 remaining terms. So what I see as benefits, and I think what folks see as benefits to term limits, if there are some, is sort of infusing that fresh perspective into legislating. Some of the benefits, you hear about term limits are, you don't have someone in a position of power like chair of appropriations for 30 years. Is it inevitable that person will be corrupted? No, but there's a much higher likelihood of, corruption or just undue influence over someone who holds a position of power like that for an extended period of time. So, legislative term limits really help rein in, infuse that fresh perspective, rein in, some of those long-standing power structures that you find sometimes in Congress and that people, are often critical of. The pitfalls are also not to be overlooked. I find the pitfalls of term limits really to be the drain of institutional knowledge that we see with every cycle. We have speakers who are in their positions for only 2 years and really not even halfway through their tenure. They have leadership races going on to the next cycle. And so people taking on chairman positions of committees, making big decisions over potentially big budgets or big policy areas with little to no legislative experience. I mean, maybe a couple years at the most. That's not to say these individuals aren't intelligent, aren't motivated, aren't well-meaning in many ways. It's just to say that there's a steep learning curve to understand the legislative process, the players, the policy, and term limits really erodes that ability to develop that institutional knowledge, through experience. There are efforts to change legislative term limits, and you will find an opportunity to vote in November on a ballot proposal that will, arguably loosen the term limits, although some don't see it that way. What the proposal does, in addition to providing some transparency measures for people in office, what they have to disclose as far as their personal finances, the term limits change in this proposal will allow someone in the House, for example, to stay there for 12 years, or someone in the Senate to stay there for 12 years, as opposed to 6 or 8. But that is their lifetime limit. So it actually decreases the lifetime limit, but allows them to stay in one chamber for a longer period of time. Some might think that's a positive step forward and a reasonable solution to term limits. I've heard lots of criticisms of that as well. So we're going to talk about the current political landscape here. The current legislature, we're in the 2021-2022 session. We are about halfway through the second year. We're going to see a lot of changes in 2023, which I will get to. But we currently have Republican-led Senate and a Republican-led House with Senate Majority Leader Mike Shirkey in the leadership position in the Senate, Senate Minority Leader Jim Ananich, and then Speaker Jason Whitworth for the Republicans, and House Democrat Leader Donna Lazinski for the Democrats. We have seen some shifting of these numbers due to special elections. Unfortunately, we've lost a lawmaker to cancer. We've lost some lawmakers to other positions, moving on to, maybe be the Kent County Treasurer or a mayor of town. And then, we've had some interesting special elections that have really shaken up the power dynamics of it. We had one very strong Republican district that flipped Democrat in a special election recently. So that gave the Democrats an extra seat that no one anticipated. So Republicans still hold majority in both chambers, but it has changed, fluctuated a bit, just even in this legislative cycle. The other thing I want to point out, I always find interesting and eye-opening, is that the Republicans have held the majority in the Senate since 1984. There is a chance through the new maps that the Democrats could take the Senate or the House. There's optimism from the Democrats in both chambers. And so that would be the first time, if Democrats were to take majority in the Senate, that'd be the first time in almost 40 years that they would have control of the chamber. Redistricting. We have to mention redistricting. The last time we had this webinar, June of last year, there was a lot of unknowns with how the maps maps would shape up, whether they would kind of fulfill that expectation of voters, that they be fair. But what kind of brought about redistricting, I will mention real quick, is that in 2011 maps were drawn by the legislature, and that was kind of the standing system at the time. And even Republicans who controlled the redistricting process came out of that with some questions around fairness. And that really led to voters approving Proposal 2 in 2018 that allowed for the creation of the Independent Citizens Redistricting Commission. Now, I will be the first to say that observing that process, hearing the reporting coming out, it was definitely not perfect. And I don't think that we can expect it to be perfect, as it was a new process. You were taking people who had little to no experience in politics, which was by design, and really having them make some pretty big decisions about where to draw lines and what factors to take into account when they're drawing lines, to political fairness, communities of interest, those sorts of things that were required by the proposal. Definitely heavy lift. So the new maps we have for the 2022 election are in place. There were lawsuits to try to overturn at this time. I think everyone's sort of under the general impression that these are the maps that are going to stay, and we'll move forward with that. So we have the Chestnut map, which is our congressional map. Linden is our state senate, and Hickory is our state house. Now, this led to a lot of interesting dynamics with the legislature. We had lawmakers that were of the same party, incumbents, who were drawn into the same districts, and that, as you can imagine, caused a lot of tension within the parties. Most, if save for maybe one or two, I'm trying to think, I know at least one district will still have incumbents from the same party running against each other, but most of these situations where incumbents were drawn in together in the same party, they resolved that through someone moving to a different district or moving to a different chamber. For example, Senator Kurt Vanderwall was drawn into a district that included a lot of Senator John Bumstead's area that he had controlled. Now, John was not drawn into that district, but it made sense for him to run in it because it had most of his territory. So he made the difficult decision to say, I'm going to run in that district, which is where his colleague was residing. And that forced Senator Vanderwall to think through what his political future would look like if he's going to run in the House. We had two Democrats in the Senate, Senator Mallory McDonald and Marshall Bullock, who were drawn into the same district, who are, obviously two colleagues in the Senate running against each other in a primary. So that is an example of, they found themselves in a situation where they couldn't move, or they weren't going to go to another chamber, or they weren't going to run for another office. But most of those situations were resolved. Moving over to the 2022 election, we have our primary August 2nd. And then now I'm questioning myself. I want to make sure that date's right. Yes, August 2nd. And then we have our general on November 8th. Everyone in state government this year is on the ballot. We have, the governor obviously is up for re-election, the AG, the Secretary of State. We have our state senate, state house, as I've mentioned, and then our full congressional delegation, as they are up every 2 years. So there. It's not a presidential election this year, but it's certainly a big one in Michigan. All right, I'll move over to the state budget update. So the fiscal year in Michigan runs from October 1st to September 30th, and I wanted to just kind of walk through high level the main steps on the sequencing of getting the state budget done in Michigan. So there's a lot of behind the scenes work that goes on in the fall, going through the winter, lots of meetings with the state budget office and legislators about, budget priorities. In January, we have one of two consensus revenue estimating conferences, which brings a bunch of economists and fiscal analysts together it's a really stimulating couple hours to talk about the economic forecasts, revenue estimates, and kind of teeing up budget numbers for the legislature and the executive branch to work through in the coming weeks and months. So it helps them sort of have an idea of, how much money are we going to be working with in this budget cycle. Following the January Revenue Estimating Conference, which is usually the second or third week of January, the governor releases her executive budget recommendation, usually second week of February. And this is just the governor's recommendation on what she would like to see in a budget, and kind of puts her mark on, what her priorities are, and where she would like to prioritize state funding. That sets off the legislative subcommittee deliberation. There's usually weeks of subcommittee testimony, discussion. We have, the various departments testify before the committees of jurisdiction. We have stakeholders testify. For example, the ARC is very active with the Direct Care Worker Coalition. And we testified before the subcommittee on DHHS about our ask for the direct care workers. And then after weeks of deliberation and kind of internal discussions, each of those respective subcommittees report out their budget recommendations. And then it kind of works through procedural steps in the full committee chamber, respective chambers. And then we have the May Consensus Revenue Estimating Conference. So at this point, all of the budgets are kind of teed up for conference deliberations, which you have 3 conferees in each budget area. So if you just picture MDHHS, I don't believe the House conferees are named yet, but we have our Senate conferees named. And once the targets are set, that sort of dictates how the conferees will move forward with their deliberations. The May Consensus Revenue Estimating Conference, similar to January, is a really critical part of the budget crafting process because it often revises what economists and fiscal analysts were expecting in January. There's always, for example, in between January and May, Ukraine and Russia got into a war. That changes the economic landscape in many ways, even in our state. And so there's always those unexpected events that the May Consensus Revenue Estimating Conference has to come together and sort of adjust for. Then we have the target meetings, which are typically high level meetings about what those top line numbers are to work with in the budget process, and that is then kind of dispersed to the conferees, and then we have our conference committees and work through the final stages of the budget. Throughout all of this process, there's advocacy going on, either with the subcommittee chairs, with the executive office, with the full committee chairs, or the leadership. And at the end of this process, through the conference committee deliberations, kind of around this time is when the executive branch and the legislative branch really start to come together and say, well, this is my priority, this is my priority, and they work through the points of differences between the various approaches. We have a July 1st statutory deadline to complete a budget, and that is actually more recently put into place, and it has yet to be met as far as I can think off the top of my head. It has yet to be met due to, we've had COVID, weird budget cycles the last couple of years. And so we will see this year if that statutory deadline can be met. There's no enforcement. There's no penalty for not meeting it. It's just sort of a marker for the legislature to aim for to get a budget to the governor's desk. But we do have, obviously up until September 30th to get a budget done. This year, as I mentioned, big election year in Michigan. The expectation is that both sides of the aisle, and Republicans, Democrats, the executive branch legislature, they all want to get a budget done before they hit the campaign trails. The education budget in particular is always a high priority because schools have to plan starting in July. They're usually running on a fiscal year beginning in July. So at the very least, that education budget is a high priority to get done before July. So we will see if that election motivation helps to bring us to meet that July 1st deadline. Really quick on the state budget front, I wanted to mention, we're on the slide, the state budget update. I wanted to talk a little bit about the trends of higher than expected revenues. This has really been unfolding since a very bleak May revenue estimating conference in 2020, where the economists came together. We were 2 months into the pandemic, and they basically said, we're going to have a $3 billion budget hole, and no one knew how to fill it. And the whole summer was just, speculating on what are we going to do about this state budget problem. And it was scary. No one knew really what the pandemic was going to bring. We were in a severe, very quick recession, onset. That did not come to fruition, that forecast, as we got, a lot of federal stimulus money coming into the state that helped, consumer spending shift in different ways, but still really, help with revenues. We had sectors of the economy that did much better than anticipated. Certainly some really suffered, like services and, restaurants, hotels. But we had some that did well, and that kind of helped balance and really improve our budget forecast much rosier than we expected. That has continued really through the first half of this year. So we're still, according to the most recent May revenue estimating conference, revenues continue to be strong and far exceed the forecast in the short term. And growth is expected to remain strong, but kind of taper off in the next couple of years. So the one thing I will add on this is that, economists are, acknowledging in these forecasts that risks and uncertainty remain that could impact the forecast. So we were wildly off in 2020. We could be wildly off in 2022 in maybe not so good way. And those risks include shifting monetary policy. How much is the Fed going to tighten rates? Inflation, how bad is the inflation problem going to become? Obviously, the geopolitical conflicts, the pandemic trajectory, is there going to be another variant that becomes much more disruptive than Omicron ended up being? And then, the housing market, among other things. So when they made the most recent forecast for our state budget going forward, it was a pretty rosy picture, was my takeaway. But just for now, I think that there could be a lot of changes. We'll certainly see, a lot of these higher than expected revenues start to taper off. And that's just important context as we work through our asks with the state budget through the ARC and our priorities. So I want to talk a little bit about the executive recommendation. So just to remind you, this is what the governor recommends in February of every year. So for FY23, I wanted to just provide highlights relevant to the ARC. There's certainly a lot in the budget that we could go through, but these are kind of the main highlights that I pulled that I wanted to talk through today. The governor in her recommendation, this was actually part of a supplemental recommendation, but she requested $135 million for direct care worker bonuses, and that would be direct care workers in the behavioral health system. These would be one-time bonuses for the direct care worker population in behavioral health. She also proposed a significant new investment in mental health supports in schools, $361 million. And not surprisingly, a lot of that it came on the heels of Oxford, and really that reconciling that's still going on over how do we address gun violence in our schools, but then how do we also address, the underlying, lack of mental health supports, especially coming out of the pandemic. Young people, it has been shown, that young people have really suffered from the isolation, the disruption, and we need those supports in schools and elsewhere more than ever. The governor also recommended $25 million for the loan repayment program to be extended to behavioral health professionals. So this is a federal, state, local match program that first at the national level administers and operates. And it's typically, or historically, I should say, been limited to medical professionals, specifically primary care. And what they want to extend this to is certain behavioral health professionals. And that's a $25 million one-time ask to extend the loan repayment program to incentivize people to go into underserved areas in the state. And as a reward or sort of incentive for doing so, they would have some of their loans or all of their loans forgiven for their training in that particular profession. The governor also recommended $325 million for the design and construction of a new psych hospital, which would ultimately replace the state-operated beds at Hawthorne Center and at Walter Reuther State Hospital. I know there's mixed feelings about that within our community, and the state legislature, the House and the Senate, did not include that line item in their recommendations, and so we will see kind of what is reconciled between the governor's proposal and the legislature's proposal as far as that goes. The governor also recommended $29 million for inpatient community-based mental health services. And one thing we hear the departments say here is that, one factor driving the lack of available state-operated psych beds is the lack of community-based psych beds or facilities to immediately respond to patients transitioning out of state psych hospitals. So I hear a lot from when they testify and when we meet with them, this step-down option needs to be expanded, and this is part of their proposal to do that. And then behavioral health home expansion was also included in the governor's recommendation at $26 million gross, and that would expand the number of homes to 5 additional counties. So currently, behavioral health homes exist in 37 counties, and so this would add 5 to that. And really, this is a model that is kind of a national, came out of kind of a national effort to integrate services. There's behavioral health homes and opioid health homes. So when the integrate services, I should say, at the point of care. And so they've generally been well received, but they're sort of in infancy in terms of expansion. So we're going to be keeping a close eye on that. I wanted to mention the ARC priorities, which would be of no surprise to anyone listening. Direct care worker wages is up there once again. So I want to make sure I distinguish our ask here from the $235 an hour. That is at $235 that we were able to get in the last budget is part of the baseline. So that means it's assumed to really be permanent going forward. So our ask is $127 million GF. That's on top of the $235. And according to calculations, we are hopeful that that would get many of the direct care workers to about $16 to $18 an hour, and at least in the behavioral health system. So that's what we're shooting for. It is challenging. I will be very candid. It is challenging because we were just able to get to $235. We know we need more. We hear from the department and the legislature that they understand that we need more. And it's frustrating when you feel like everyone is in agreement to a certain extent, but it's, whether the money is there, someone is there to really take it across the finish line. I just had a really good conversation this week with Senator Stamas, the Senate Appropriations Chair, about this ask. And he's probably our biggest champion in the legislature, and he's going to do everything he can to get it in a final budget proposal. Perhaps it won't be, the full 127, but we're hoping that we can at least get an increase for direct care workers once again in this cycle. The ARC is also asking for $2 million for a program that would expand special education supports for youth in foster care. So the idea would be to use a network of special education advocates to provide intensive support and kind of help youth understand their rights and options, and then secure needed education services in school, develop graduation plans, decrease suspensions, expulsions, and dropout rates, and ultimately, help increase achievement. This is something that Representative Whiteford did include. She included $1 million in her proposed budget. It's been well received on the Senate side as well. Senator Jeff Irwin is our kind of champion over on the Senate side. So we do hope that we'll at least get $1 million for this program. Hopefully, can expand it going forward. But that's something that the ARC specifically is working on. Medicaid and special education funding more broadly are, of course, areas that we watch. And I didn't mention this previously, but as many of you may know or may not know, we're currently in a public health emergency, which has allowed Medicaid to really expand eligibility, or not, sort of have churn and kicking people off. It's been able to increase the federal match rate that Michigan receives for Medicaid. So the state is having to put up less money. And we do expect that it's currently extended till July. Forecasters expect, at least the economists that spoke at the May Revenue Estimating Conference, are expecting that will lapse probably in the fourth quarter of this year. But there's so many unknowns. Again, will there be another variant? What will the dynamics be at that point? Will we still need to have that public health emergency in place? But the department is currently kind of going through the process of rolling out their new policies, anticipating that public health emergency is going to go away, and there are going to be impacts to Medicaid and Medicaid funding. Other priorities I wanted to mention important to the ARC that are sort of being spearheaded by other groups that we partner with. The dental program redesign was something that the governor proposed in her executive budget recommendation. And what it would do is create one uniform contract for all Medicaid programs and raise rates and expand services for Healthy Kids Dental. Obviously, there's a lot of advantages to this, including increasing patient access to dental services. And this is something that, the ARC generally, supports. It's not something that we are taking the lead on, but I wanted to lift it up and make everyone aware that this is something the governor has proposed. The legislature has not had an analogous proposal, but it is something that is a priority, seemingly a priority for the administration, and we will hopefully see some at least increased rates for dental services and some realignment, improved, streamlined design of the dental program. Title V and Title X. I assume many of you have seen the action alerts that have been sent out. I know the Maternal and Child Health Council has been sort of spearheading the advocacy on this, but I wanted to mention, as there are implications potentially for persons with disabilities, specifically within the Title V program. And so it gets a little convoluted and confusing what the legislature did, but essentially Michigan has been receiving federal funding in all states for these two programs since around the 1930s. And it's not something that's ever been controversial. Obvious reasons why it might be controversial now, but what the legislature has done, proposed at least, and this is not final, this is something that the legislature is going to work out with the governor, hopefully. The legislature has proposed taking the federal funding that we receive sort of rejecting that federal funding and backfilling it with general fund with our state funds. Now you may ask, is that problematic? Because the programs are still going to receive the amount of money that they were set to receive. So it's not necessarily a cut, but it creates a number of problems. First, there's certain outcomes measures and requirements that come with the federal program and certain entities that are set up to receive this funding. There would be a lot of questions around the operationalizing of now the state funded programs and whether that's going to be the same as the way the federal is set up. Lots of questions there. But the bigger concern is really the long-term sustainability of that funding. So if we reject the federal funds, as no states have done, I will point out ever in the history of the program, if we reject those federal funds and then we find ourselves in a precarious state budget position in 2 years where we don't have the funding there, that gets really concerning, that we might have the state funding there, and then we have to go back to the federal government. Well, will we be able to go back to the federal government to help support those programs? So there's long-term sustainability issues with that approach that we're closely following. The Title 10 money, as I understand it, is not as much of a concern because it doesn't have to go to the state. It can go to an entity. So an entity such as Planned Parenthood, for example, could apply for that funding and get it. And so that that Title 10 funding from the federal government could still be here and be intact, and it probably would be. But that Title 5 funding has to go to the state of Michigan. And so if we reject, the state rejects it, then we're basically turning away federal dollars. Behavioral health supports in schools, I wanted to just lift this one up again. It is the governor's recommendation to invest $361 million. We are in support of many of the initiatives that fall under that. Certainly always historically have been. I think, as I mentioned, now more than ever, that support in schools is so important. And then certified community behavioral health clinics and behavioral health homes are also priorities that we closely follow. Now I'm going to roll into our current legislative issues and just highlight kind of our top priorities. We work on lots of, work on big issues, but there's always lots of small, seemingly small, bills that are introduced that Sherry's helping to kind of block and tackle or, weigh in favorably on. So, while these kind of big issues sort of hang over us, we're also doing a lot of smaller advocacy work as well and kind of monitoring what's being introduced that could impact persons with disabilities. The big one, I don't have to tell any of you right now, is behavioral health reform. That sounds okay, but the devil's in the details. We're certainly supportive of some reforms to the system, no question. There needs to be some changes made. But what has been proposed in the Senate, really spearheaded by Senate Majority Leader Mike Shirkey, is really not palatable to the ARC, and our official position is that we oppose. The kind of foundation of that plan, I won't go into all of the details, but the foundation really is built on this changing of financial administrative functions from the PIHPs to the Medicaid health plans. And they would be essentially be a specialty integrated plan that would then oversee the financial management of the behavioral health system as they do currently the physical health system in the mild to moderate populations. So persons with disabilities would then, fall under the Medicaid health plan's jurisdiction. There's also some ombudsman oversight language written in that's not too terrible. Certainly, we're pushing for more oversight of contract enforcement, ensuring that people are held accountable that are providing the services, but among other things. But this, our position is that the Senate proposal as written is not the way to go to fix the problems with our system that really affect people receiving the services on the ground. On the House side, Representative Mary Whiteford has proposed a reform measure that we are more supportive of in concept. Would kind of create a statewide ASO, is what she calls it. And that would be sort of the overarching entity where all contracts would run through. The hope is that that would provide kind of more accountability and kind of streamline statewide, so you don't have these pockets of, you can get services over here but not over here, and this patchwork that we found ourselves in. Probably not a perfect plan by any stretch, but we're supportive of the concept and the direction that she's going in, and I apologize for sort of that rough overview. It's a lot more detailed than that, but I will spare you that. Representative Whiteford and Senator Shirkey, as I've laid out their two plans, they're very different. They are attempting at this point to have some discussions to reconcile their different visions for behavioral health, and it's unclear at this point, where those discussions will go. It's unclear at this point whether the Democrats would get on board, either the legislative Democrats or the administration, but they are having discussions, some of which could have tangential impacts with the kind of broader budget context. Senator Shirkey has proposed a behavioral health supplemental that is still sort of hanging out there, that could be used to help encourage people to vote for his reform, and really could help potentially with the governor swaying her to come along with some of his ideas. But I will just say, we're keeping a close watch on how those discussions unfold. We're meeting with, the various players. And we certainly have been trying to emphasize that any kind of behind closed doors discussion on a complete overhaul of our behavioral health system, especially in an election environment that we're in, is a complete non-starter and completely inappropriate. So, we've been very clear on that it really has to be an inclusive stakeholder process if you're going to make complicated changes or changes to a very complicated system. I'll mention really quick healthcare transparency and access. So within this, I kind of weave in there's been a number of prioritization reform measures that have gone through, which is really great in terms of kind of bringing down barriers to accessing medications. On the Medicaid side, there was a bill that Senator Hertel spearheaded that was signed into law this spring that would ensure that any medication that falls under kind of within the mental health structure, that they would not be subject to prioritization. So any Medicaid, any mental health medication prescribed under the Medicaid program for a Medicaid beneficiary would not be subject to prioritization. And then there's also been some just general reforms to the prioritization process that insurance companies impose, just so people are not experiencing those unnecessary delays and can access, what they need when they need it. Freedom to work is an issue that we've been kind of working on and off on, and really this is kind of the Medicaid buy-in program in the state of Michigan, and allows individuals with disabilities to have higher levels of earnings from work, but still qualify to receive Medicaid. So the kind of crux of the issue is that many people with disabilities, require attendant care services in order to work, and Medicare does not provide those services. So, when you hit the age of 65, freedom to work lapses. And so we are attempting to allow for freedom to work to apply to people who work past the age of 65. And so that's something that we've worked on a bit with Senator Jeff Irwin, and looking to find some champions on the House side as well. Guardianship legislation is also on the table. And this is a product of discussions with the Elder Abuse Task Force. The Attorney General is very involved in this discussion. And the effort is really looking to reform our guardianship statutes to ensure that there isn't kind of that abuse and exploitation that goes on with people having, one guardian to 900 wards. And looking at, okay, there's definitely some problems in the system. How do we reform this in a way that allows people to access guardians if it's appropriate, but there's not this allowance for kind of an exploitation or kind of profiting off of the system that we have seen. The ARC generally has had some concerns with the direction these bills have gone in. They've been really a product of a lot of negotiations between the Guardianship Association folks, probate judges, and then the advocates. So there's differences of opinion on whether these are going to help move the needle. Some see it as one of many layers to address, and the state will address. So we're watching those closely. Neither the Senate proposed bills, introduced bills, or the House introduced bills has moved forward through the committee process. And I mentioned earlier, we follow any legislation impacting persons with disabilities. So there's, weekly things that pop up that are introduced or taken up by a committee that we're following. And then this last part of my presentation, I wanted to talk about how to be an effective advocate. So we're going to move to the slide about influencing government here. And I will say that the longer I do this work, the more I realize that what ultimately gets done in government really comes down to two main sources: money and people. And so, even if an organization doesn't have enough money or doesn't, contribute political, do political giving or contribute to fundraisers or a campaign, often they have people, they have their grassroots, they have their constituents that, make contact with legislators and help influence, one way or the other, the direction of legislation and policy. Some organizations have both. Some have money and people, and some just have money and not people. And, I don't want to call out my insurance lobbyist colleagues, but the insurance industry is an example of that. They have a lot of money, they're very influential in that regard, but they don't have kind of that grassroots to kind of get their message across. And so you're always competing on kind of either of those fronts, and sometimes a legislator's personal or political agenda I would kind of put on the second tier. That definitely influences decisions. If someone is elected to office and they had, some sort of experience over the course of their career or their life, that can certainly influence their decision making. But for the most part, it's really, is it money or is it people? And kind of making a compelling argument for policy one way or the other. So in terms of whether you're engaging in a proactive legislative effort, individually, or you're part of an organization, it's really important to cast a wide net. And that means, you include both the legislative and executive branches. Communication breakdowns are probably, one of the biggest problems plaguing our policymaking world, especially in the last 2 years. You can imagine with the pandemic and everyone working from home, you think that so-and-so is talking to so-and-so, the governor's office is talking to the speaker on this. And so often the case is that they're not. And so if you're, meeting with the legislature on an issue that you care about, let's say, you're pushing for a bill, you want to ensure you're meeting with both the House and the Senate. You're meeting with the department that might impact, and you're meeting with the governor's office. And you're ensuring that there's, you kind of make sure you're addressing any opposition that might be coming, but also just ensuring that everyone has a heads up on what you're advocating for. And people appreciate that, and there is so much flying around in Lansing. As I mentioned, we have a full-time legislature. So if you can kind of be that communicator across various entities, the various players in the legislature and the executive office, and that's a lot what the lobbyists do, obviously, but the advocates can do the same. That's really important. And as I mentioned before, the legislature is led by Republicans, but it's really important that if we're pushing a bill, for example, for the ARC, something that we want to get done, having it be bipartisan. Obviously, it needs to be signed by a Democratic government. It is really important. There are certainly times where a Democrat-led bill gets through the process. More often than not, you should have a Republican spearheading, but then try to make it bipartisan. And then, make it bicameral too. Make sure that the House is aware. If you start your bill in the Senate, make sure the House is aware. And they're supportive as well. There's lots of times where, the Senate will pass a bill over to the House, and it's not their issue. They don't feel ownership over it. And so, there might be some inertia there. Sometimes it's out of your control, but to the extent that you can control it, make sure you're having conversations on both sides. All right, strategies and tactics. Just quickly, this is kind of a brief rundown of, either as an organization, your strategies, tactics, or as an individual. But from the organizational perspective, from the ARC perspective, we try to be both proactive, in the issues that we're working on, put forward our ideas. What do we want to see in behavioral health reform? But unfortunately, it's just kind of the reality of the legislative policy world that you are going to be reactive to. There's going to be people who come into office who have ideas about addressing this issue that their sister faced, and they might not be well baked. They might not be, insightful in terms of, what the real world implications are. And so we often have to react or kind of play defense a little bit and make sure we're educating legislators about, well, we see the intentions are good, but it will have this unintentional impact on, over here. And, there's a lot of times, as I mentioned with term limits, that you find that there's well-meaning, well-intentioned proposals, not understanding the full context and the full breadth of the impact. So we often have to be reactive, and play defense, and that's just kind of part of the game. Strategic and properly timed, and what I mean by that is, don't introduce a bill in September of next year, or September of this year, I should say, or October, and think you're going to get it done for the end of the year. At this point, I'm hearing if it's a first chamber bill, which means if it hasn't passed the House or it hasn't passed the Senate, we're at the point in the legislative session, close to the election, nearing the end somewhat, where, those first chamber bills are just not getting done. So you need to make sure you kind of come in early, you really lay that groundwork, and you build that support early on in the session as far away from the election as possible. And then building that brand of familiarity, people knowing who the ARC is, knowing who you are and who you represent. Just having that special relationship with your legislator is so important as you kind of lay that groundwork to get an advocacy strategy moving forward. The foundation, just wanted to mention again, kind of dovetailing off of what I said about relationship building. How can you relationship build? Really getting out in the district, helping support a candidate. There's so many opportunities right now. You don't have to give money. You can knock doors for someone. You can just meet them at a coffee hour. A lot of candidates have free events. They certainly appreciate when you support them financially. And there are events, that kind of, allow you to, you have to obviously contribute, but then allow you to have kind of that one-on-one time with them and build that rapport. But there's so many, non-monetary ways to get in front of legislators and make sure they're familiar with you and then, familiar with your issues. Message timing and consistency. Again, knowing what your message is, being consistent about that message. Just because you meet a legislator at a coffee hour and then you walk away, I can tell you you're going to have to come back multiple times because they're meeting with countless people on countless issues. Some are uncanny in their ability to retain. I will call out Eric Nesbitt, the potential future Senate Majority Leader or Democrat leader. Either way, he'll be in leadership for the Republicans in the Senate. He's sort of one of these people that you tell him something, 3 years later he remembers it. He is definitely an anomaly. There are a lot of legislators, and this is not a knock on them. They're so saturated with information and people talking to them about it's all important issues. It's what's important to whoever they're hearing from. So make sure that consistency is there in building that relationship. And then obviously lobbyists help with that as well on behalf of the ARC. Meetings in Lansing, and if you do come to Lansing, I tell people, obviously make sure you're researching the lawmaker. What do they care about? Are they running for reelection? You should, presumably you're a constituent in their district, so you would understand their district and could talk through the dynamics there. But what's their political party? What committees do they sit on? Kind of knowing all the ins and outs there is really helpful. And then, if you're meeting with a legislator on an issue, kind of reflect on, your position, and most importantly, what's your story? What is important? Why is this issue important to you? Why do you want to see changes in the paper health system? And if you have something personal that you can share, I will tell you that I just spoke about retention of information, data, and stats, and all of that kind of more complex information that's shared. For the most part, that's going to go in one ear and out the other. But if you tell a compelling story, many times they'll remember that, and that will stick with them going forward. And so always helpful to reflect on your story. And then I kind of lay out, when you do meetings in Lansing, make sure, you're dressed appropriately. That would be, not too strict down here in Lansing, but not Hawaiian shirts and flip-flops, as I have seen some folks do in the past. And business casual, presentable, and make sure you're flexible when you're going to meet with a legislator. A lot of times, and Sherry is so patient in this. A lot of times, session goes long, they can't make a meeting, or we have to move it to another day, or we have to move it 30 minutes. So flexibility is really important when you're meeting with a legislator. Obviously, these go without saying, being punctual and friendly to staff. I always want to say friendly to staff because especially with term limits in Lansing, the staff plays such an important role. And, many times the staff, we've actually had a fair amount of turnover in staff throughout the pandemic, probably more so than historically we've seen. But many staff stay on for years, and they are really that institutional knowledge. So being friendly to staff is, no, I'm good. Is it working now? Oh, so sorry. Apparently our IT person just figured out how I could log on to GoToMeeting. So yeah, we're about done here, but next time I will definitely know how to get into GoToMeeting, something with our plugins. There's something don't have expertise in. So personal connections, staying on message. Brevity is always important, and I call myself out because it's now an hour and 7 minutes I'm talking to you. So brevity has not been part of this presentation, but generally when you're talking to legislators, you got to keep it short and sweet. Get right to your bread and butter of what you're asking. And then, follow up. I think it's really nice to write a handwritten note. That's just, harder to come by these days. People shoot emails. That's fine too. That personal touch is always nice. If they've requested documents in the meeting, hey, do you have more background on that? Or do you have a one-pager? Obviously follow up. Either we would do that or you would do that as promised. And then again, establish that consistency and continuity is very important as you pursue your advocacy strategy. All right, I'm going to wrap up here. In the slides, there are the resources that I think are important. This is certainly not an exhaustive list, but I do mention the National Conference of State Legislatures. I wanted to source them. But all of these resources are helpful in acclimating you to the state government makeup landscape. I will call out the House and Senate fiscal agencies. If you really want to nerd out to some policy papers, they have really great content, and they are really our institutional backbone and knowledge backbone in Lansing. And we have great analysts that write up, good analysis on various policy issues. So I'd point you there if you have interest. All right. I will now turn things over. I really appreciate the opportunity, and I again apologize for the technical difficulties, and I will open things up for questions.
Hi, Kristen. I hope you can hear me. We have a question. When you're talking about the budget, what decides if an expenditure is gross or general fund?
Oh, sure. Yeah, so gross is federal and state combined, and then general fund is just state. So sometimes, there's federal dollars that are drawn down for a certain expenditure. Sometimes it's just coming out of state coffers. So that's the distinction between gross and gross could also, I suppose, gross could also include local. So federal, state, and local. It's that total amount. And then general fund is just the amount of state funding. A good question. I probably should have clarified that. I appreciate that question.
We're looking at the slide with your phone number, and I think I have it wrong. I have it as 571, and I'm 99% sure it should be 517.
No, it is 571. So I am originally from the DC area. Northern Virginia is 571 area code. And so that is actually my cell phone number. And I've been strongly considering changing it because it's created so much confusion. But 571 is correct. So that's a good idea to call that.
Thank you for clarifying that. We don't have any other questions at this time, Kristen. Thank you for working through our technical difficulties.
I really appreciate it. And as I said, I appreciate everyone's patience. Really was on my end. And I'm going to figure out for the future how to make this work. So thank you for everyone's time. I hope everyone has a wonderful Friday and a wonderful weekend.
Thank you, Kristen. So I want to thank everyone for attending today. We will meet again next week at 10 o'clock where myself and some of the ARC, my colleagues that work within the ARC will be going through some of our public policy initiatives to give you guys more detail about the work that's going on here. So if you're interested in that, please join us at 10 o'clock next Friday. Thanks, everyone. Have a great weekend.